I turn to this person for insight and direction and counsel from time to time. I revere her opinion. The editor of The Nation, Katrina Vanden Heuvel, with us tonight.
Thank you, Ed.
Katrina, what is the progressive community going to say when this is all said and done? Is this a victory?
I think it's a bitter pill to swallow right now. It's a tough time to be a progressive who believed that a public option was an all-American option. It was about competition. It was about choice. The progressive community, as you know, Ed, had already stepped back from fighting for Medicare for all, for single payer. So here we are. And I think, Ed, you raised the right question. How did we get here? And I think part of it is this dysfunctional Senate. It should not call itself a democratic body. It is the least democratic legislative body in a country calling itself a democracy. And secondly, there's a difference between pragmatism and leadership, Ed. President Obama's very tepid leadership, on fighting for a public option, has led us in many ways, not solely, but has led us to this place we are at tonight, where we have seen the best possibility for taming profiteering insurance companies, for giving people an honest choice, for taking the profit motive out of health care. That is now off the table, and we're left with a kind of jury-rigged option here, a menu of private insurance offerings. The only good thing I would add, Ed, is tonight we're seeing a buy-in for Medicare. You talked about how it's only for 3 million people, but it is the largest expansion of Medicare in 44 years. I think they should just keep moving, Ed. Let's lower Medicare eligibility down to 50, 45, 40. Let's get Senator Kennedy's, and what would he say if he were here with us? Let's get his great Medicare for All plan. That's what this country really needs.
I just can't allow, Katrina, the conversation to get to a point that because we want to do something for American families, we're all of a sudden radical.
I know.
That just boils me in my soul.
And this is common sense. This is all American, the public option. We wanted a robust public option because it showed the way. What is it that these insurance companies are so fearful of the marketplace? Don't they believe in that? Let them compete. So here we are. And I think, as I said, this is not radical. These are common sense ideas. And today, we talked earlier at, the polls. They show a majority of Americans, even after Republican attacks and conservative Democrats and Joe Lieberman, who thinks he's the president of healthcare, holding hostage a public option that a majority of Americans support. I think we need to end the grip of 4 conservative Democrats on what a majority of senators seek. This is anti-democratic. The use of supermajorities has been abused by the Republicans, and we now see a result here that ramifies. It's not just a procedural maneuver. It ramifies in people's lives. Now, what's going to happen, I fear, but the fight's not over, is we're going to see all this melding and blending. Fight's not over. And I think we should keep fighting for that public option. As I left my office, Move On, the Working Families Party in New York, which is always trying to push the Democrats in a more progressive direction. Call Senator Schumer in New York. Call your representative. There's more work to be done before this is over.
Katrina Vanden Heuvel of The Nation, always a pleasure.
Thank you.
Thank you for speaking the truth. Wendell Potter is a senior fellow on health care at the Center for Media and Democracy. He's a former vice president for the insurance giant Cigna. How do you call it at this hour, Mr. Potter? Good to have you on tonight. I thought you'd be the perfect guest after the news that broke last night and all these compromises that are being made. Give us the winners, give us the losers.
Well, as I'd said really months ago, that if we weren't careful, what we'd see coming out of Congress would be the Insurance Industry Profit Protection and Enhancement Act. And that seems to be exactly what we're about to see here. And I think if Democrats don't step back and see what they are about to create here, that they will be wishing they had, because what we will see here is exactly what you described before. We'll have, in the next few years, people being forced to buy private insurance companies, many of them having no choice but to buy it from for-profit insurance companies, knowing that part of their premiums and taxpayer dollars are going to go right straight into investors' pockets. They're not going to be happy about that, and they're going to blame Democrats for it, and rightfully so.
Now, the public option isn't the biggest part of the bill, but if you're looking down the road in future generations, it's huge. It has to be in there, because once you get 3, 4, 5, or 6 million people involved in the public option, they have positive outcomes, and that portion of reform works. It sets the table for real moving forward. Right now, what I believe we have is a lobbyist bill. Is it, or is it not a lobbyist bill, Mr. Potter?
No, it's absolutely a lobbyist bill, and you're exactly right too. Undoubtedly, they're almost popping the champagne corks around the insurance industry right now, because it is clearly written by the insurance industry, and the insurance industry, its strategy was to focus on 4 or 5 members of the Senate who could derail real reform, and they're getting really close to accomplishing that.
The Democrats are ready to take whatever they can get. One other issue that is being discussed today is the amendment by Senator Dorgan, the importation of prescription drugs, something that President Obama, when he was a senator, supported. And now the FDA has written a letter to all senators saying that they have some security issues with all of this. This would save this country billions of dollars in terms of saving the consumer a bunch of money. And now it looks like there may not be enough votes for that. This is another victory for the insurance and big pharma, is it not?
Well, it really is. I mean, just look at Europe. I mean, those countries there have figured this out. It's not something that is causing great harm to the European community. It's just total nonsense. It's just something else that special interests have been able to do to keep the profits high. And that's exactly what is going on here.
Mr. Potter, good to have you on tonight. You've been a real resource through all of this battle. I appreciate your time. And you're a man of courage. You have come up and spoken against the industry, talked about your past experiences, and told the truth to the American people. We need more like you. I appreciate your time.
Thank you very much, Ed.
I want to say this about President Obama and this show and the Democrats. I carried a lot of water for this president on the radio. I did as much as I could. I did town hall meetings all over the country. And does this mean that I'm going to say, well, no, he's not the answer and we got to move on, got to find something else, third party time? No, it's not. Am I disappointed? Yes. But I will say this. The president, in the next phase of health care reform, once we get this, if there's a successful conclusion in the midterm in November and we get more seats, I would like to see this administration make a commitment on the campaign trail saying we're not done, that this is just a start. And if we get more seats in the Senate next year, and there are 38 races, that we're going to do a lot more than what we're starting with right now. I want to hear that. So much more coming up.